Hello, Assalamu alaikum warahmatullahi wabarakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about one of the sexual problems found in one of the sexual issue commonly found in men nowadays as porn-induced sexual dysfunction. Porn-induced sexual dysfunction is a term used to describe the sexual difficulties, especially with a real partner that some men report after a frequent or a long-term use of highly stimulating pornography. It is not yet officially a medical diagnosis, but clinicians and researchers increasingly discuss it as a behavior linked sexual problem involving brain's reward system. Let's look into what happens in brain in this condition. Pornography strongly activates or stimulates the brain dopamine system, that means the reward and motivation pathway of the brain, and over the time the brain adapts to this high intensity stimulation. But when it comes to a normal life or a real life intimacy with a partner, it may feels like less arousing. So the person may need more novelty or extreme content to feel the same excitement. This is similar to what happens in behavioral addictions. Common symptoms on this are men with porn related sexual issues may notice erectile problems with a partner. In this, difficulty in getting or maintaining erections during the real sex, but he gets normal erections when watching porn. That's the difference. He gets normal erection while watching the porn, but he gets difficulty in erection or he gets difficulty in getting erection or maintaining his erection during the real sex. Now, number 2 is reduced arousal with real people. For him, the partner feels like less exciting compared to the porn. He may feel difficulty in staying mentally engaged. Number 3 is delayed ejaculation. It may take long time or impossible to climax with a partner. Number 4 is loss of libido, or in real situations, he may feel desire is present for porn but not for real intimacy. Okay. Number 5 is escalation. He may gradually seek more extreme or novel content. Let's look into why this happens or key mechanism that's happening. Number 1 is dopamine desensitization. Repeated overstimulation or while watching the porn, he gets repeated overstimulation which leads brain become less responsive, and which results in need for stronger inputs. Number 2 is conditioning. The man's his arousal become linked into the screens, specific scenarios and solo behavior instead of the real partner. Number 3 is performance anxiety. After a few bad experiences, the fear builds up in him and anxiety worsens the erections problems. Now let's look into who is most at risk. Number 1 is frequent porn users, that is especially daily users or multiple times daily. Usage of porn starting at a young age. Number 3 is the people or persons using highly novel or extreme content porns. Number 4 is combining porn with the habitual fast masturbation patterns. Now, next I'm going to describe about some important clarifications. Watching porn occasionally does not automatically cause dysfunction. The risk increases when the use is frequent, compulsive, or escalating, and it starts replacing the real life intimacy. Okay. Now let's look into the recovery. What helps? Reduce. Number one is reduce or stop porn usage. Many men reported improvement after 2 to 12 weeks. Some may take longer time depending on the duration of the use. Number two is rewriting your brain. Focus on real life attraction and connection. Avoid artificial stimulation during recovery time. Number three is adjust masturbation habits. Use slower, less intense stimulation. Avoid unrealistic patterns. Number four is manage expectations. Note in mind that recovery is not an instant process. Temporary low libido or flat line can happen sometimes. Number five is address anxiety. Relaxation techniques and open communication with the partner helps a lot. Number six is healthy lifestyle. Exercise boosts blood flow and testosterone. Good sleep restores the hormone balance. So that's the key. Practice healthy lifestyle. Now let's look into when to seek help. So if the symptoms persist, reducing porn usage, severe erectile dysfunction still occurs. If you feel anxiety or compulsive behavior feels uncontrollable, then you should see a therapist or a doctor, especially one trained in sexual health, and that can help you. The key points to note: porn induced sexual dysfunction is mainly about conditioning plus brain adaptations, not a permanent damage. In most cases, the brain can recover and resensitize with the time and behavior changes. So keep in mind that. So we are stopping here today and we will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.